I'm Dr. David Sarwer. I'm the Associate Dean for Research in the College of Public Health at Temple University. And I'd like to welcome you to the latest installment in our video series highlighting the research accomplishment and achievements of our faculty in the College of Public Health. Today, Dean Laura Siminoff is joined by Professor Heather Traino, and they will talk about their important research looking at regional differences in solid organ transplantation rates based on communications between patients and providers.
So Heather, I guess what we're going to talk about is the paper we just published in the American Journal of Transplantation, in which we discovered that there are some significant geographic differences in donation rates. So for people who aren't familiar, the way the American organ donation system works is that we're divided into 11 donor service areas, and within those 11 regions there are local organ procurement organizations. These organizations are responsible for asking families to donate organs for transplantation and then making sure that those organs are distributed, sometimes all over the country, according to rules that are set up by the government for how patients who are in need should get an organ. We did find some interesting things in that study, and I'm wondering for you, what were the most interesting findings that we had?
So the study really highlights the importance of communication to organ donation. So the regions that had some of the lowest rates of organ donation also had some of the poorest indices of communication that were occurring, and this is from the family's perspective. So some of the more specific findings were that families in those regions with poorer rates of authorization also reported being less satisfied with the request. They felt they were more likely to feel pressured or harassed about organ donation. They were actually talked to with the requester about fewer organ donation related topics. So things that really are critical to decision making were lacking in some of those locales where the lowest rates of authorization were found.
Right, and some of the locales that have the worst rates of organ donation tended to be those that were dense urban areas, that the populations were a lot more diverse as compared to where we found the highest rates tended to be areas with less dense urban areas and a more homogeneous population.
Absolutely. And so I think really this highlights the importance of communication and the fact that from our previous studies that these factors are truly modifiable, and we can, with some training and persistence, really help to improve the communication that is occurring during the requests, and then hopefully those outcomes, like the number of organs available for transplantation.
So I guess the big takeaway message is that you can train people to communicate properly, and that with good communication skills training, we could do a lot better in providing patients in need with transplantable organs.
Absolutely.